Welcome to The Consult Room, your go-to podcast for all things anti-aging, aesthetics, and plastic surgery. We're your hosts, Brittany DeSherry, Taylor Besh, and Dr. Jonathan Weiler. And each week, we'll dive deep into the latest trends, expert insights, and we will bring real patient experiences from the world of beauty and wellness, aesthetics, and plastic surgery. Hey guys, welcome to The Consult. Before the cut, I'm Brittany DeSherry, COO of Rejuvime Medical, and I have here with me today Dr. Jonathan Weiler.
Yes, I'm a board-certified plastic surgeon, been in practice for about 15 years. I also work with Brittany over at Rejuvime, one of the founders over there.
Taylor Besh with Weiler Plastic Surgery. Excited to hear what we have in store today.
Expert injector over here,
Yes,
so it's been with me for going on 15 years, almost like a marriage.
So, today we are going to deep dive into male TRT, which is testosterone replacement therapy.
TRT, yeah.
TRT in men over the age of 45. We have with us today Bree Berard. She is one of the nurse practitioners over at Rejuvime Medical. She has been with us for 4 years now.
Three and a half years
now.
Time flies, huh?
And everything. So she is our expert gal today on all things TRT. So,
and I'm going to function as a dual role a little bit. So not only am I part of this podcast, but I'm also a patient.
He is going to be the patient today, later on in the podcast.
Yes.
So we'll be able to grill him and ask him all
the things.
Personal experiences.
The emotions behind it and everything.
Absolutely. Absolutely.
Yeah. So we are going to really just go ahead and get into it. So Bree, if you could kind of help us out here. And kind of tell us like what TRT is.
Yeah, so testosterone replacement therapy, gosh, it can help so many things for so many different types of people. For men especially, that is their most dominant hormone. Mm-hmm. And so as you age, it does tend to decline. Kind of like women go through menopause, men go through what's called andropause. And those levels decline over time, causing fatigue, low libido, just low mood, brain fog, so many different symptoms. And giving that testosterone back can help all of that and help you be your best self.
Awesome.
Yeah, and Bree, compare it to, menopause. Does that make sense? So obviously, maybe a lot of our listeners are not aware or just hearing the word andropause.
Yeah,
so
and what exactly is the word testosterone? I know it's a hormone, but what does that hormone do?
What does it do?
So testosterone at the base of what it is, it's your body's ability to build and maintain lean muscle, but it also helps with, like I said, the energy, the mood, that brain function, your cardiovascular function, because that's a muscle too, right? Your heart, pretty much everything at at your core.
Libido as well.
As well.
I always say it's what makes if you think of a man classically, like what makes a man, right?
Mm-hmm. Yes.
And estrogens and progesterone, or estrogens are what make a woman, sort of, the female characteristics, right, versus the male characteristics, right? So, and we'll go a little bit back to biology, right? As you develop, right, we sort of come, if you're not affected with hormones either way, you sort of develop the same way, right? Little boys, little girls, very similar. If you have a little boy with long hair, you can look like a little girl. If a little girl with short hair, you can look like a little boy, right? And it's not until puberty, right, where you get those surges, massive surges of hormones that really differentiate the sexes. And so I think you could classify it as it's what gives you your secondary sexual characteristics, right?
Yes.
I would say that, huh?
Yeah.
Mm-hmm.
I think that's definitely a good explanation.
But I always say, explain to the audience, menopause is everybody kind of knows, right?
Everybody knows about menopause.
Right. You know the ages, what happens, right?
The whole thing.
There's a Menopause Awareness Month.
Yeah.
Really?
There's a whole month about it.
There's a whole month about it.
But
That's
for men, it's...
So what is andropause exactly?
Yeah, so it's very similar to what women go through, but it's not really talked about in men. But it is kind of this deep cut in their hormones where everything just drops off.
When do you see that starting?
Gosh, usually around age 35, it starts to dip.
Okay.
A lot of factors go into it as well. If you're under a lot of stress, working shift work, things like that can affect it. Yeah, lifestyle.
Previous athletes, right, that have sort of run and gunned, and all of a sudden
they're not.
You stop working out, you stop doing your stuff, and you become a dad, right? That can certainly affect it.
Absolutely.
So like these patients, so like we said, this andropause
Yeah.
is typically starting in this 35, plus. When are they seeking help, I guess? Or is it like,
Or are
when
they
just
seeking
feel-
help?
Are
Is
they?
it common?
Yeah.
What do you think?
Are they aware?
Yeah.
I think they're very aware.
Okay.
A lot of times they'll come in, they're like, I don't know what's wrong with me, but it's something. Something
Yeah.
is not right. My doctor says everything's normal. And of course, the lab range of normal for testosterone is not optimal.
Right.
It can range from like 260 all the way to 900. And
Right.
that's a huge range.
Right.
Even a female can have a 200 testosterone. That is insane. And like you said, that's how we differentiate,
Well, you know what I always say is crazy with labs, and this will get a little bit more technical, but labs are not based on age, right? And
Right.
so labs are based on you're either dead or alive, right? So you either have testosterone or you don't. So when they get these sort of what is the average, they take, you could be, they really take the average of anyone that has that secondary sexual characteristics, let's say 16 or 14,
Yeah.
all the way up to still living at 90.
Right.
Oh, okay.
And so,
Yeah.
which is kind of crazy because, obviously there's some peaks, that rise up, and then obviously there's some falls, but, you probably are not going to have the same testosterone levels at 35 that you would have at 85.
Oh, absolutely
And
not.
the lab doesn't differentiate for that,
No.
or normal levels do not, which is interesting.
yeah.
That's what I feel that is kind of like that I feel like that's one of the biggest things that everybody, gets their PCP and they're like, oh, your labs are normal.
Right.
They're normal.
Yeah.
And then they feel hopeless.
And then they're
Yes.
just
they're like,
like,
well, I'm normal. I
well,
don't feel normal.
But something's wrong.
Right.
You
And
know?
that's usually when they show up at our doorstep. You
Right.
know, they're like, something's definitely wrong. Everyone tells me I'm normal, but I'm not.
What are the most common things that, say, a 40-year-old guy comes to you and he says, my PCP says I'm normal, I don't feel great. What are they experiencing? I know you said a couple of things from mental to
Yeah.
physical to what are they telling you?
Sometimes it's very specific to gym things. They are hard at working out. They're used to lifting very heavily and they're getting very sore very quickly. They're not able to lift as much and they're not seeing the results from the workouts that they're doing. So for some patients, that's what it is. For others, it's sexual dysfunction or just not having that libido or that drive that they used to have. For others, it's just the fatigue and the mental fog. They're at work and they're not concentrating as well. They're not sure why, but they feel like they need to take a nap at 2 p.m. every single day. No matter how much sleep they get at night, they don't wake up feeling well rested. And that's a big problem for them too.
Yeah.
Yeah.
What is your typical age that you see patients, your male patients, coming in at? Does that make sense? Or
It does.
Yeah.
I would say between 35 and 40 is
Okay.
usually that big grouping. But we do see, I had a patient last week who was 78 when he came in, first time seeing us, and that was cool too.
So he had never been on testosterone until then?
He had.
Okay.
He
Okay.
had stopped it and then wanted to come back and see us and see what the options were.
Oh, that's great.
Yeah.
That's
So you see this person. What are you doing? What lab work? How do you know? How do you diagnose a patient with
Low T.
Yeah.
with low testosterone?
Yeah, so we do a full lab panel, which has complete blood count, a lipid panel, checking cholesterol and everything like that. Your hormones come from cholesterol too. So if you've got really, really, really low cholesterol, sometimes that could be part of the problem as well. We also look at a metabolic panel, which has all of your kidney function, electrolytes, liver function, and then, of course, the hormones, your testosterone, your thyroid, your free testosterone, and your DHEA as well.
estrogen.
Estrogen.
Estrogen's a big factor, I
It
know,
is.
too, with testosterone replacement.
It is. And a lot of people get very nervous about it because, you can look online and it's
nervous about estrogens?
about their estrogen.
Okay.
Yeah.
So when you take testosterone, sometimes it can elevate that estrogen level. It aromatizes or converts a little bit, which is
Right.
totally normal. You do need some estrogen,
Correct.
but if it's a little too high or too much, you can get some pretty severe symptoms, all the way from just feeling a little bit more emotional, watching your kids play in
Yeah.
the backyard and you're like tearing up a little bit, or all the way to like gynecomastia,
Right.
which is a surgical problem.
Yeah.
So it really does vary. Sometimes men just get a little bit of night sweats with it, and they
Right.
call me. They're like, "Gosh, I've been sweating every night, and my
Right.
wife says I'm a little bit more emotional. What's
Right.
going on? Like, ooh, let's
Welcome,
check
sir.
that out.
Welcome to womanhood.
Welcome to the game, guys.
But it's
Like,
really nothing to be afraid of
Right.
or nervous
Yeah.
about. It's definitely easy
And
to
not
manage.
everybody, to be clear,
Right,
not
yeah.
everybody gets that.
No, absolutely
Right.
not.
And it's and when we say gets that, we're not talking about the side effects. We're talking about a rise in
Yeah.
estrogen.
Yeah.
It's just
And
a
so-
small rise usually. Yeah.
And usually that's very well tolerated. And usually, patients do really well.
What is a level that you like to see your male patients at when
like an optimal.
Like an optimal level.
What
Yeah.
are they usually at when they're feeling like this, and then where are you seeing correction, or does that vary so much?
It varies a little bit, but I would say, when they first come in, they're usually less than 300. And we like to optimize that at least to 800 or, a little bit above that. 800 to 1,000 is usually the sweet spot for some guys who were previous athletes or, really active in their younger years. They probably functioned at like a 1,200 level for so long that they may need to be up there a little bit. And guys who weren't quite as active and probably lived a little bit lower than that do fine being, 600 to 800 sometimes.
Yeah.
So
Okay.
it is.
Yeah, some people have
Very-
been low
yeah.
for so long
Yeah.
that getting them at 500 to 600, they feel like a different person.
Yeah,
So it's
they're like,
it's
"Oh,
very
wow."
dependent.
Yes. So life changing.
Right. It's interesting. This is totally off topic, but everybody lives at a different testosterone level. My wife recently told me, which was odd, and this is not male test, but my doctor used to tell me all the time how high my testosterone was. It was like, well, it's good information to know. I've been married to you
Right.
for over
Like-
15 years. It's like,
Really?
she lives at a high
So
level of
it's like, you're
testosterone.
just
So
like, yeah, I've been just
explain some
kicking
stuff.
it.
but no, everybody, I think it's so dependent on the patients, right? It really is.
Absolutely.
Yeah. It seems very patient specific.
Oh yeah, I mean, I think it's like you said, like some people need that very high level. Some people just need just a little bump, and they feel a whole lot better. Do you think that TRT or male testosterone replacement is more widely accepted these days? It's sort of do you feel like it's a hot
Yeah, I would
topic?
say
or-
yes.
and I'm not
resounding
even
yes.
the
Really?
expert.
Yeah.
Absolutely.
I say yes. And I think it's more talked about, kind of like menopause and things
Right.
like that
Yeah.
too. We're a lot more open these days. And I think
Yep.
testosterone's much more accepted. I have primary care doctors or urologists who actually refer their patients to us
Really,
to be treated.
right?
I just feel like it had such testosterone had, testosterone replacement therapy or just hormone replacement therapy in general had such a negative
Taboo.
Yeah.
like it was so taboo for so long that you were doing that. But I feel like now it's far more accepted.
yeah. I mean, I'm obviously the elder statesman here. But I think growing up, you saw, you heard about steroids, and
Yes.
you heard about,
Right.
and then the Arnold Schwarzenegger. I mean, you see these guys, and then you hear about all the bad side effects, right?
Yeah.
And we all know that a lot of professional wrestlers would, take a lot of that stuff, and so I think there was a lot of negative connotations to hormone replacement. And then there's these studies that come out every year or so, right? Especially in the female literature,
yes.
right? It causes cancer. Oh, no, it doesn't cause. Oh, it does. And
Yeah.
it's back and forth and back and forth. And so, there's lots of misconceptions out there, I think, about testosterone replacement. And primarily, I tell patients that it's safe if done correctly, right? And so
Absolutely.
medically monitored. Traditionally, it's more of a quote unquote of a cosmetic type medicine, right, or an elective medicine, because typically insurance doesn't pay for the levels that it needs to be at, right? And
Agreed.
that's always a battle. So that's one of the reasons why our lovely sponsor Rejuvime exists, right?
Yes.
Because they optimize, right? And so yes, insurance may pay for it once a month, but you really need it weekly or biweekly. And then 3, these sort of side effect issues people talk about. It's proven safe, right? It's proven safe if you monitor it. There could be, if you don't monitor it and you're not aware, there could be side effects like you talked about. But if done
Yes.
properly, it's safe. It doesn't create this giant bodybuilder body,
No,
right?
absolutely not.
It's more about energy, more about drive,
Yes.
more about, like you said, just getting back to life than anything else.
Yeah. Overall health.
Right.
So we haven't talked about, say you have that guy who's the perfect candidate. How do you take TRT, or what do you do?
Yeah.
How do
What's the
you do
route
that?
of administration?
So, the route of administration. So there are a couple of ways you can take it. You can take it in a cream that you apply every single day, which is a struggle for some people because they don't want to do something every day.
Right.
And for some people, that's perfect. Injections are going to be the gold standard. I typically prescribe it twice a week. That keeps you pretty close to your natural pattern, which is important. I find that's when you get the less side effects too. It also comes in pellets. Pellets typically don't do really well for men, so I currently don't have any male patients on pellets. But it is another thing that we like to talk about and talk about why it doesn't work well too.
So with the injections, so you were saying that, but now, I mean, I know a lot of your patients, they're doing it like twice a week, but it's sub-Q. It's not even
Right. It's sub-Q, so it's really easy. You can do it at home.
Okay.
They can do it themselves.
They can do it themselves.
Explain
like insulin.
explain what sub-Q.
Right.
Sub-
Sub-Q means, ladies.
So sub-Q is just a really tiny needle, like an insulin needle, right into the belly, right underneath that first layer of skin on the surface. It does not have to go in the muscle.
Yeah. So I feel like that intramuscular injection. I feel like that may be a little scary to people. Because I feel like they associate it with like a flu shot when they're like, oh, my arm,
right?
Yes,
and being able to
the little ones
have the
don't even
ability.
really feel it.
Yeah.
Explain a little more why pellets are not ideal for men. They're used a lot in women.
They're used a lot in women,
but they're not used for men.
Men need a lot more pellets than women do, just because of the amount of testosterone that they're going to get. More volume. So whereas women might need like 1 to 3 tiny little pellets, men need 10 to 15 of those.
Oh, wow.
Yeah.
So it really does create a lot of scar tissue. It's hard for them to heal. And then with that
and
big
I feel like
surge,
their muscle
they don't
is
have
so
a
much
lot of
stronger
booty.
and bigger.
Men have a tighter amount.
Yes, a tighter
leaner
booty.
rear. Right? Women naturally have a fuller, softer rear.
Yes.
Men have a tight little rear, and it doesn't hold the pellet very well.
Correct.
Right.
And then with that big surge of testosterone, you're going to get a big surge of estrogen. So you're kind of just going to be chasing things. It's just not the best.
Well, I feel like you would just like taper off, but like not in a good way.
Not in a good way. It's not going to be as consistent as a man needs.
And I know I prefer the subcutaneous injections. The topical testosterone, I've had lots of patients that have, you've got to slather that stuff on your body.
You've got to slather that on.
And you can get transfer of that to your partner.
Yes.
Yeah, you've got to be careful.
Yeah, so I have had female patients come in with really high levels of testosterone because they physically intimate with their husband and they're sliding testosterone all over the place.
Yeah,
I've seen that.
And they're absorbing it.
They're absorbing it, which is crazy. So that's certainly
you got to be very careful.
Yeah, testosterone topical is not ideal. It's certainly done, but I would say it's not ideal.
How long does it take? Like once you start the TRT and everything for male patients, when are they going to start getting back to their self that you're trying to get them to?
You usually feel a difference in the first 2 to 3 weeks.
Okay.
And then you can see results, from the work you're putting in at the gym, physical changes closer 6 to 8 weeks.
Okay. All right.
It's awesome.
And then, so is the golden question, right? People always ask is what happens when I come off, or is this a lifetime thing, right?
Right. So it's
And I'll give you my answer for this.
it's definitely meant to be a long-term
Yes.
therapy.
Yes.
And that is going to be your best bet for longevity and just feeling good for a longer period of time. You can absolutely come off of it. We have patients come off of it all the time for various reasons. Usually takes about 6 weeks for your body to start making that hormone on its own again. Sometimes we'll do a little medication to help so you don't feel so low for so long. But you can come off of it, but it's not really recommended.
Yeah.
You're going to go back to the
You're going to
low
go back.
level?
Yeah,
Right.
you're going to
And
go back to what you've made before. So it's
Are you
Well,
going to,
you can't, the thing of it this way, you can't cure aging.
right.
Yeah.
We're all aging together, right? And so really what happens for a lot of these patients is just like, menopause is for females is so obvious and direct, right? Because menstruation stops, right?
Yes.
And then so men is just a longer sort of slog or drag out, right? But you can't reverse, you can't cure aging. So you can treat aging, and that's what we're doing here, right? Is you're treating
Absolutely.
aging in the males with testosterone replacement, so you don't get any younger.
Well, yeah. And I like,
unfortunately, right?
I'm like, well, that's
when we invent that, we'll be very wealthy. But
like if you get on test and if you get on test at 45 and you're on it for 15 years and you get off of it at 60 for, whatever reason, say you just want to kind of like hang it out.
Take a break.
I'm like, I also feel like you're not going to go back to your 45 testosterone.
Right.
Like
You're going to be lower than
you're going
that.
to go back to your 60 testosterone, which I feel like is going to be
even lower because you've aged.
Right.
Yeah. And it reminds me of any kind of medication you would take for things like blood pressure or thyroid disorder. If you stop taking it, it's probably going to go back to being bad.
Right.
Yeah.
And not only bad, but you've aged 15 years.
Right.
Yeah.
So it's going to be worse.
It's going to be worse.
Gonna be worse.
It's going to be worse, right?
You'll be
Definitely not what I'm
back.
looking for.
We're ready to.
All right, so we'll take a little break here, and then I will come back as the patient.
Yes.
I'll be sitting in the same seat, but these ladies will be peppering me with questions, and I will explain my journey on TRT therapy.
Get ready.
From Botox to tummy tucks, we provide patients with real confidence. Weiler Plastic Surgery. Something real.
My weight's always kind of fluctuated throughout the years. I've worked out, did CrossFit, worked out on my own. My weight kind of goes up and down. I do good for a little while. COVID kind of came around and just put on a lot of weight, and then that's when I heard about semaglutide with Rejuvime. I dropped the weight fairly quickly. Being a dad, taking it, I feel revitalized. I feel like my old self. I have a lot of energy. My experience at Rejuvime has been awesome. It's very easy. Everybody's friendly. I would definitely recommend it.
All right, guys, welcome back to the consult room. We'd like to thank our sponsors, Rejuvime Medical. Just saw a little commercial from them and Weiler Plastic Surgery. They help us pay for and get this video cast off the ground. So I will now convert over to a patient.
Yes.
And I will let you ladies take over.
All right.
So, Dr. Weiler, today is his birthday.
Yes.
Happy birthday, Dr.
Happy
Weiler.
birthday.
Thank you.
So as he becomes the patient, we just have wanting to kind of get a little bit deeper about your personal experience with TRT. So
Sure.
give us an idea of what you're experiencing and the progression and how it's kind of fit into your life.
Yeah, so some of this is, so I'm a plastic surgeon and went through general surgery, went through my plastic surgery training. And of note, I was in a very bad accident, I guess in between my fourth and fifth year of training. So of general surgery, which was, I'm getting old, 20 years ago almost.
Gosh.
So
I was graduating high school.
oh my goodness. So I was in a really bad accident, and I was crushed between two cars. And so, ICU, multiple surgeries, lost a lot of my intestines, and have some fat absorption issues. So you mentioned cholesterol. Also in that time, I was married, had 2 kids, and started a practice. So all within a span of probably 3 years. And so,
Which is unbelievable.
That is wild.
Superhuman.
Oh, right.
a little crazy. So I'm not exaggerating. My wife had a baby, and I had a big surgery up here, and we lived in Baton Rouge. We were living in New Orleans. She moved into a hotel with the kid, and I went to lay the lake for a week and had a surgery. It was crazy. And then 4 weeks later, opened a practice. So, I have a problem.
What a ride.
My wife thinks I have a problem. Yeah. And she's probably right.
She stayed. Kudos to her.
So, built the practice up, and Taylor joined me. And then really, I was an athlete in high school and played college rugby, and, was never an elite, college athlete like some of those husbands here. But, was always active and things like that. And so, life sort of starts to catch up with you, and you start to get, I really started feeling very, very fatigued, tired all the time, not springing back. In plastic surgery, we do a lot of physical procedures, right? It's, the surgeons have the highest disability rate of any profession, actually, because you stand for 12 to 16 hours a day.
Liposuction is
Liposuction is intense. I'm known for doing larger lady tummy tucks, right? I do a lot of those. So those are physically involved. So, it just sort of caught up with you. Most of my issues were more about like chronic fatigue, tiredness.
I feel like burning the candle at both ends.
Kind of burning the candle at both ends.
It just kind of
takes
a toll.
It does. And so this was, probably 12 years ago. And I don't think, TRT or testosterone replacement therapy or hormone replacement therapy was really more in its infancy. And so
it was more taboo.
It was much more taboo.
Yeah.
Much more taboo. And I remember, Taylor kind of helped me get the practice kind of going. And I literally hopped on a plane, went out to California to go to a seminar about it, and was sitting in a seminar in California and started Googling different companies, and ended up Florida, the Tampa area, Miami area are real hotbeds of hormone replacement therapy and anti-aging starters. Sort of the West Coast, and then that part of Florida. So went down there and did a lot of training and learned a lot of stuff. But that's kind of where it started.
Go back to you though.
That's it.
Okay.
Yeah.
So you're like, okay, I think they're speaking to me because I need this in my life.
This is me. I've got.
How
these
old were
symptoms.
you when you started?
So
TRT?
That's a good question. So probably 42. I'm 51. Yeah, how about 8 years ago?
Okay.
Yeah, probably about 8 years ago. So my kids were 15. So they were like, that like really physically, like 6 years
Young,
old.
nonstop.
Chasing nonstop.
If you're up late that night, your kid's up at 5:30 a.m. jumping in your bed, with a diaper full of pee, right? Called the pee-pee diaper, right? And so flipping the lights on and off. Get up, get up, mommy, get up, get up,
Time
daddy.
to wake up.
Time to wake up. I'm hungry.
You're like, what?
So at that's having kids is demanding
Trying age.
the whole way too,
Yeah.
but that's a physically demanding age for kids. And then my practice was just sort of getting started. I was working in Hammond. I was working in Baton Rouge. I was
Still
back and
doing
forth.
insurance.
Still doing.
Still
I was
doing
taking
breast
call.
recon.
I was taking call. So I actually took call from St. Tammany Parish Hospital from Covington to Baton Rouge, and I was still taking hand call. Oh God, I was doing all kinds of stuff. Operating in Slidell, so I would have to get up and drive
Putting in the
around.
work.
Yeah, I was working a lot.
Just a real low time for you.
Yeah.
It's like you had a lot of stuff going on.
Yeah, a
or
lot of stuff
anything.
going on. A lot of physically demanding stuff, and just couldn't recover from it.
Yeah.
And then physically your body starts to change. Like to be honest, I'm not a huge workout guy. Should be. I'm trying to get back into it. So, but I've always been kind of genetically blessed to just sort of naturally maintain muscle.
Yeah.
And so noticed that was really starting to suffer over time.
So when you went and you were like, hey, you found I'm assuming you did some research on some doctors and providers that are doing this. So when you went to them and, told them what was there, like, how did they, say like, oh, this is going to be what you need. Like, what was that? Like when they started prescribing you the medication, was it in injections at that time? I know we said this was 8 years ago.
It was. So they were still doing like a decent amount of pellets. I think actually at that point years ago, the injections probably weren't as frequent. It was more topical.
Yeah.
That was like sort of the accepted medical therapy was androgel, or the urologists were prescribing primarily topical testosterone, and so your anti-aging hormone replacement community was still using it more than it should be probably.
Yeah.
You would go to the meetings and they would talk a lot about topical testosterone replacement. They still talk decently about male pellets. The injection stuff probably was even a little more taboo back then, even 10 years ago. Just sort of like talking about the bodybuilder stuff.
Well, I was going to say, I feel like it's
Yeah.
associated with that black market test.
It was. And, even I think like the information available was more geared it was on like the bodybuilding websites, you know, and the guys that were the big players. And I'm not, you know, look, I work out, but you know, and I'm not. I'd say I try to be very non-judgmental.
Do the Peloton.
I do the Peloton.
Come
But, you know,
on.
I think like a lot of the
credit.
docs that were doing it were these big jacked up dudes.
Right.
And I think there was a
It
lot
was
more.
a different representation.
Different representation of where
We
it's
kind of
come.
felt out of place at the conference, like
Correct.
at the
Yeah, like, you're
A4M.
A4M, yeah,
You're
A4M,
like, do we
and
belong here?
exactly,
Like,
exactly. So it had a little bit of a different feel. Now, it was just starting to like I say now, like we're on the cusp of true anti-aging medicine,
Yes.
right?
Oh,
You know,
yes.
with all our the GLP-1s and we've got the hormones that have become so popular and really so refined, and there's all kind of stuff coming down the pipeline. But that was like right at the edge. So you got into it, and I was like, oh, I don't know about this. And then, you know, I went and went down to Florida, met with a doctor there who, super nice guy, very normal, and he really had
Very
built,
knowledgeable.
very knowledgeable, had built himself into an expert really in the fields and very transparent. And I was like, you know, and discussed the symptoms and all that. And he was like, oh, definitely, you'll feel like a different person. And then it was like, oh, you're going to do, no, we do injections. And I was like, what, really? Okay. No topicals? You know, because I come from a very traditional medical background.
Yeah.
Right.
And, you know, this type of medicine, what we do, it's sort of like plastic surgery. It pushes the envelope a little bit,
Yeah.
right? You know, plastic surgery is an elective procedure.
Yeah.
Some people think it's crazy, but, you know, I love it and patients love it. Same thing with this, right? You don't necessarily need testosterone to survive or replacement. We do need it to survive, but you don't need replacement, but it's a quality improvement of your life.
Yeah.
Right.
So I went down there and started the therapy and really, you know, felt miraculously better.
What has it done for you? 8 years later, looking
yeah.
back from where you are now compared to where you were.
I blame all my success on testosterone.
Yeah.
But no. What has it done? That's
Energy.
No, look, it's given me. Sometimes my wife accuses it of giving me too much energy, but it's given me sort of. It gave me back. I always say, you know, if you want to feel like you felt in your mid-20s or early 30s, if you want to enjoy your life again, you know. And I'm an older parent. We got married after 35, so we're not super old, but you know we're older parents. So you know if you want to enjoy your kids, if you want to get back up, your body not hurt every single day, if you want to see the results of your workouts, if you want to have the drive and energy to finish your day at work,
Focus.
It's given focus.
Libido.
Yeah.
All that has come back. You know, very well. I think energy-wise for me was really the biggest change, to tell you the truth.
So will you stay on, your plan is just to continue to stay
Oh
on
yeah,
TRT?
no, I mean, I bring it with me on trips. I do I follow what Bree recommends. So I like a twice a week subcutaneous injection.
Yeah.
Yeah.
My levels, I probably stay at around 600, 500, 600. And actually, I do. I see Dr. Chastain, who Britt used to work with.
I was going to say, I did not, I didn't know, like I wasn't, because I come from the ICU. So like there was no testosterone knowledge. And when I started working with Dr. Chastain and
What type of physician is he?
he does men's health.
Men's health.
Okay.
He's a
Yep.
PCP, but focuses on
Okay.
men's health. And I did not realize, and that's when I first started, that's the first time I'd ever like really dealt with testosterone replacement. When I was one of his nurses, I assisted him in his executive wellness program. And just kind of like you were saying earlier, obviously it's an insurance thing. These guys would only come in once a month, every 2 weeks, because that's what insurance had suggested. And so, but just seeing them, like from when they would come in to where it's like, okay. And then when I came to Rejuvime, really kind of pushing that envelope, you know, and getting to these optimal levels, like you really do see
Night and day
It's
difference.
a night and day
Yeah.
difference.
Yeah.
And it's like I said, it's absolutely wild. Like just, and
Oh,
everybody
It's crazy.
just feels good.
My original testosterone level was below 100. I think
Wow.
it was like 80 or something insane. And then I do twice a week, and it's kind of funny because I now see Dr. Chastain as my primary care doc, and my levels run around if it's you're supposed to measure your levels the day before you do an injection.
Correct.
And so my levels run somewhere between 300 and 400, which is crazy. I can get them higher, but I don't necessarily need them higher.
Right.
Yeah.
And that's with a twice a week. I usually do like 0.35 twice a week. So, I'm doing, 0.7 to 0.9, depending on what I'm doing.
Pretty conservative there.
More conservative.
Yeah.
Which goes back to the patient specific thing.
Yeah.
Right.
You're
Yeah.
one of the ones that,
Totally different from
Right. And some
other
guys
people.
do, 200 milligrams or a cc a week.
Yeah.
There's all different ways to dose it. So I just, because you asked me I'm never coming off of it. So, I'm going to be on it till I'm 85. And it's kind of, I think
don't
it
stop
makes
there.
it well,
Don't
you
stop
look
there.
at, I mean, people like, just the aging process, like to me. So, my dad's getting a little older and he's in his 80s and he's doing fine, but he's getting weaker and all this. And so my brother-in-law is on testosterone replacement with me. And he calls me up. He's like, "You think your dad could use some testosterone?" He's a dentist. I'm like, "Yeah, but I'm not getting involved with my dad's." I think he could. I think he definitely would help him.
I mean, anyone
get stronger
can.
because you see him, and me and my dad are built very similar, and he's he's having trouble walking because he's losing his muscle mass,
Yeah.
right?
Yeah.
And then you look at someone like, some people think, and I'm not going to talk about Sylvester Stallone's face, but Sylvester Stallone is in his mid to late 70s, right? I think he's like 78 or something crazy.
Yeah, but
Yeah.
And he has a hit TV
keeping up,
show.
yeah.
He looks like a brick house, right?
Yep.
And, his face, whether you like it or not, it's a little, it's a whole different podcast. We'll talk about
That's another episode
Aging.
that we're going to talk about.
Right. But
aging.
I mean, look at him. He's an influencer on Instagram.
Yeah.
Yeah. He's out
He's
and
got
about.
a beautiful wife.
Yeah.
I'm sure they have a great relationship now that they've reconciled. But he's got it's just and just from the looks of him, he's been doing hormone replacement his entire life.
Yes.
As has like
Yeah.
Arnold Schwarzenegger.
Yeah.
Now, obviously in their youth, they were overdoing
I was about to say
things.
maybe a little.
They were doing way too much.
too hard.
But if you look at both of those guys now, there's no doubt that, Stallone and Schwarzenegger, those guys, I could sit them down here today and talk about, I could probably know exactly what they're doing. They're doing it right at this age.
Right.
They were doing it wrong possibly. They
Yeah.
had different, but they're in their late 70s. They look great. They feel great. They're still influential and working.
Yeah.
And, part of it is really quality of life. And for me, it's just dramatically improved my quality of life. And
Have you had any negative side
I was
effects?
about to say, any side effects?
No, I haven't. So,
What do you do to manage your?
so the one side effect I have is it can drive up your blood levels a little bit, right? It increases, for the non-medical, the viscosity or thickness of your
Yeah.
blood, right? And so that's just something you got to watch. And there's a very easy treatment. You just donate blood.
Yeah.
So
Right.
every once in a while, maybe once a year now, I'll donate a little blood, and it's a simple 15-minute procedure. I actually used to donate blood before, so I'll go donate blood. And you check your labs to make sure it doesn't go too high. Sometimes you can feel it even if it goes a little bit too high, but that's really the only side effect I've had. I rarely have to take any estrogen blockers. My body just doesn't respond that way to it. So you don't have to take estrogen blockers if you're on
Correct.
testosterone. So I rarely
Yeah.
take any at all. Beyond that, I've really had zero side effects. And so, I'm living proof. I've been doing it for 10 years now. I don't treat myself because I'm a
Right.
physician. So
that's no.
that's no.
Yeah,
It is
that's
a
a
controlled
no.
substance, so I don't treat myself. But honestly, you even as a physician, you really should have someone else telling you what to do.
Monitoring you,
Yeah.
checking
Because
your
you just,
labs.
you'll
Yeah.
blow, how you just blow things off. And so I still use the same physician out of Florida that I started with. Just because we have a huge practice here, but I don't want to intermingle.
Cross
so
lines.
Yeah.
cross lines. So I still use a physician out of Florida. Still talk to him regularly about it. I've gotten very consistent. My body had a lot of problems. I wasn't absorbing the testosterone, which is weird. So I don't know if you come across this. I actually was taking it at first. I started it weekly, then I went to twice a week, then I went to 3 times a week, and then I had
wow.
to start doing it 4 times a week. And I was taking like a massive dose, like 300 something milligrams
Oh, wow,
a week.
yeah.
What would be the reason?
I was about to
for
say,
that?
is this having
Well,
to do with your?
Is it related with the accident, maybe?
Accident maybe because of my cholesterol levels and things like that, and then sex binding hormones.
Yeah.
I was having issues with, and then my body started to respond to it, and then I slowly ramped it down, and then now I do it twice a week. At the dose I said. It took me about 4 years to get there, which was weird.
Oh, wow. Yeah, that's a long
My body
time.
was a little bit non-responsive. So you can have some weird sort of things go on.
And this is just something you and your doctor, like, y'all worked through.
Yeah, it's
like,
kinda
he
worked
was
through.
just
Yeah.
like, hey,
Yeah.
like, we're going to figure this out.
Yeah.
That's why I just kind of like going back when we talk about like anti-aging providers specifically. I feel like when you are looking for a provider for these hormone replacement therapies and stuff like that, it is very important to get somebody who
Very knowledgeable in
very
those.
knowledgeable,
Yeah.
very
Yeah.
focused on this. I know even for like the women, I know we've had OBs that's like, no, listen.
Oh, a lot of
go
OBs
see-
will not
Right.
touch.
They're like, go see
OBs will
Rejuvime.
not
I
touch
know,
testosterone, which is
And then-
outside of their realm, which is good for them not to fool with.
Yeah.
know your
Right.
limitations,
Yeah.
but also like making sure that if you are finding a physician, a nurse practitioner, anybody that is prescribing it, that they are very well versed in things like this and can
Well,
dive.
I think the problem is the misconception is you have these guys in the gym, right, and
Mm-hmm.
they talk about it, and God knows what you're ordering online.
Oh God.
Yeah,
And
that's
then
so
you're
scary.
injecting it into your body. And there's a great National Geographic special that testosterone is the number 2 product of the cartel.
Oh, my.
Really?
That is
Illicit
very
testosterone.
interesting.
Yes. I'll have to show it to you. It
I guess
is-
we are in the right
I
business.
was
No?
So illicit counterfeit drugs is the number 2
Wow.
product of, they got
Wow.
your
Yeah.
high,
Right.
Yeah.
get high,
Like
illicit
your
drugs.
Schedule
Your
ones.
Schedule 1. And then the
Like-
secondary ones is chemotherapeutic agents, your GLP-1s and your
That is
testosterone.
wild.
I can see that.
And
Yeah.
because they mass
Yeah.
produce it in fake quantities. So, so number one, you really want to get it from a legitimate source.
Yeah.
And pay the few extra dollars,
Yeah.
to do it. And then number two, it is, my journey was more complex because I couldn't get my levels up. It took a lot of back and forth with a provider. Even though I was training, becoming the expert, I still needed his insight in it. And it took me time to get to my equilibrium where I felt good. And, so it really is important to have somebody that, in person, or you can pick up a
Right.
phone like Bree and say, hey, this is what I'm feeling.
Yeah.
I'm having this side effect, or, can you help me out? Because it really is. I mean, you do it all the time, Bree. It's an intricate process.
Very much so. I think that's probably the most important thing, is to be able to have someone that you can call or email or get in touch with on a day-to-day basis
do
in
the
case you have
fine-tuning.
anything. Yeah.
Yeah.
You want to be able to get
Perfect
that.
plug for Rejuvime
Rejuvime,
Medical.
right. Well, because these are powerful medications.
Yeah.
I mean, they really are powerful medications, and they affect the way you feel, right?
Yeah.
And
Yeah.
so,
Yeah.
but yeah, my journey, I know I'm kind of rambling here, but it's been all over. It's a long journey.
Yeah. But I mean, it seems like it's a good, like,
Oh, no,
it's
it's
a
all
great,
good.
like,
Yeah.
it's been positive.
Look,
that,
and we'll talk about this in the future podcast. My wife went through menopause, and it only reinforced my belief in
Yeah.
hormone replacement.
That's it, yeah.
Especially,
Very
I've been on it
powerful.
for a long time, and now she's gotten on hormones, and I always say it extends. It sounds weird. Your usable life as a human. Does that sort of make sense?
No, yeah.
It certainly improves the quality of your life.
I will say, as an outside looking in, Dr. Weiler, being the medical director of Rejuvime Medical, the passion that he has from his personal experience
Yeah. It
has
helps.
pushed this
Oh, yeah.
company so far, because he believes in it truly to the
Yeah.
core. So
It makes it so easy to, talk about it and like believe in it when, people ask me, like, I'm on testosterone. When people ask me, when girls are like, I don't understand, like, why, it's like, y'all, like, it's so good. Like, if you could
Yes.
just, once again, because
Yeah.
it's been so taboo, but, of course, just being passionate about it and knowing how well it can work, it makes it so much easier to be like,
It really does.
You should do this.
It
Like,
brings
it's
you
gonna
back
be-
to life for
Well,
sure.
it's just like, okay, we treat high blood pressure, right?
Yeah.
We
Yeah.
treat heart disease.
Thyroid. Yeah.
We treat thyroid. We treat
Yeah.
so why don't we treat hormone deficiencies
Yeah.
in the same fashion? And, there are people that have, at a young age, and you see them come through, hormone deficiencies. Now, the majority of patients, though, come in and the hormone deficiency is due to aging, right?
Correct.
And so, why was it taboo, or why is it? It's still a little taboo,
Yeah,
but why is
little
it
bit.
taboo to treat aging? It doesn't make any sense.
I think
to me.
this kind of rolls off of what we talked about a couple weeks ago with the baby Botox and this younger generation. So,
Yes.
I'm 37, but
Yeah.
even you were saying that 35, we are much more geared into this we are
The
trying that
anti-aging, right.
anti-aging portion. So I think this generation is a lot more open to treating
Absolutely.
health,
Yes.
we're trying to prevent, we saw it in our parents and everything like
Yeah.
that, the high blood pressure, the diabetes, the high cholesterol.
we don't
It's
want that.
I don't want
No.
that. I don't want to age.
We want to live our best life for as long as
Right.
possible.
Well, think about it.
Exactly.
Look, we're the generation that, or at least my generation, we're the generation that kind of kicked smoking to the curb.
Yeah.
Right.
Everybody used to smoke. My parents' generation, everybody, and then sort of my generation, we started out smoking.
Yeah.
Everybody was smoking in high school and all this stuff, and now most of my friends and girls that I grew up with are kind of pushed it out. Vaping has kind of crept in, but my kids and y'all, there really was no smoking.
Yeah.
So,
Yeah, I don't know anyone who's smoked.
exactly, which is a good thing, right?
Which is wild, though.
Right.
It used to be
Right.
so accepted.
Right. And so you just said the magic word accept. So I feel like my parents' generation accepted aging.
Right.
Yeah.
Right. I feel
Yeah.
like my generation is fighting aging. Right.
Yes.
And I would say y'all are probably not quite a generation below, but y'all are a little bit younger than me.
Yeah, but
Y'all's
it's-
generation is not going to accept
It
aging.
Yes.
preventing it
It's
from
going to prevent
Yes,
aging,
we're
right? 'Cause
trying
you guys
to.
are the
Yes.
the filler, the Botox,
Yeah.
the aesthetic
Yep.
surgery, and then right behind it is the hormone stuff,
Yep.
right?
Yep.
We Taylor does fillers for a living and Botox, and I don't think that's really taboo anymore, but I still think there is some taboo.
Yeah,
with
I think there's
hormone
always going to
replacement,
be,
right?
because like you said, the studies,
Right.
the studies that are coming out nonstop,
Right.
it's good for you, it's bad
good,
for
right.
you, it's what is it,
Right.
everything, it does this, it does that.
And,
It's
and literally
it's
in
always
my
back and forth.
medical career, it's flipped, I think, 4 times back
Yeah.
and forth.
Yeah.
Which is
So,
crazy.
but I think it's
We're
getting
believers.
to, we are absolutely, I'm a huge fan of it.
Huge fan.
I like it from the female side, but
So
good.
any other questions for the patient
Yeah.
here?
I think that's it.
no,
that
I don't
function
have
as-
I
anything
think
else.
that was
Thank you
really good.
for,
Thank you
so
sharing.
much.
Thank you for
roles.
sharing that
Yeah.
that
Good
journey
insight.
with us, and happy birthday.
Thank you.
Since we don't have any questions,
Thank you, Bree, for
I know,
coming on
thanks,
today.
Anytime.
for coming and sharing your insight with us. And everybody, thanks for tuning into the Consult Before the Cut. We hope you found valuable insights to guide your journey. Remember, every decision counts. Take your time, seek advice, and always consult before you cut. Until next time, stay informed and stay inspired.
Wise words. Bree. Thank you.
See you later, guys.
All right, guys.